Hello, everyone, and welcome to Legislative Journal with State Representative Josh Shapiro. I am Kevin Hensel. Thank you for joining us. And I think the issue of the day, and for many, many days, has been health care, both here in Pennsylvania and around our country. I know it's something you are passionate about.
I am, and it's been an issue I've worked on since I had boots on the ground here in Harrisburg when I got elected back in 2004. You know, I'm privileged to represent a whole lot of providers in my community in Abington and Upper Dublin. It's largely based on the fact that, we have two amazing hospitals in my district, Abington Memorial and Holy Redeemer, who employ so many people and do such a great job for patients throughout our community. But I've tried very hard to try and increase access to health insurance and make it more affordable for people, and as well as trying to keep doctors here in Pennsylvania, bring new doctors to Pennsylvania. I think we've seen some success, and layer on top of that, obviously, the national reform, which is going to drive a lot of what happens here in the next couple of years.
But what are some of the things that you are working on here in Pennsylvania?
Well, number one, we've got to make it more affordable for small businesses and individuals to purchase health insurance. And what I find when I look at our state laws, if you're a small business on Old York Road in Abington, you got 12 people in your shop, and you want to go get health insurance for your employees, you're really going up against the system there. When you call Blue Cross, Aetna, whomever you're calling to try and get benefits, you don't have a whole lot of leverage. It's sort of a take it or leave it approach. Well, I think those small businesses on Old York Road and Easton Road and all across our great community should be able to band together to pool their purchasing power and then go out and have some leverage and be able to buy health insurance at reduced rates. They're going to save on administrative costs. They're going to spread the risk out amongst a larger pool. So I've authored legislation to do that. We passed my legislation in the form of an amendment in the House in the House of Representatives a couple months ago. It's pending in the Senate. That will help ensure greater access to reduced cost health insurance. At the same time, we need to ensure that we have physicians practicing here in Pennsylvania to care for the needs of Pennsylvanians and people in Abington and Upper Dublin. And, here's sort of what we found. We have a real good system of providers today. And actually, we have enough providers today based on the varying numbers. But we know, according to the Department of Health, that 40% of our physicians practicing today are going to retire within the next decade. 40%.
Wow.
And at the same time, just about 7.5% of our physicians practicing today in Pennsylvania are under the age of 35. So that's like having a veteran ball club out on the field every night, but no farm team, no farm system ready to take their place. So unless we act now, we're going to have a real healthcare crisis in the next 6, 8, 10 years when these doctors retire. Well, we have acted, and we've now twice passed my legislation in the House of Representatives. It says to any primary care doc or OBGYN, that's where we see the greatest need, that if you agree to practice in Pennsylvania for 10 years and care for patients for 10 years, we'll pay 100% of your medical school loans. I think that's sort of the cutting-edge type of thinking we need in our state government to allow for physicians to have a friendly environment to come to Pennsylvania and practice in. And ultimately, when they come here, they care for us. They take care of us, and they help, certainly not only meet our medical needs, but grow our economy in southeastern Pennsylvania. So it's critical that we get this right. And again, that bill has also passed in the House now twice and is pending in the Senate. So those are two things: making health insurance more affordable and accessible, as well as making sure that we've got docs here to practice and care for us.
Well, we know Pennsylvania has some absolutely incredible medical schools, so we're producing some great doctors. The trick is just get them to stay.
Exactly.
Well, another major issue right now, we're following it on the federal level, what Congress and the President will do with health care reform. I know you've been involved in that as well with your role at the White House. What will happen in Pennsylvania if something passes on the federal level?
Sure. Well, just briefly, I was really honored when the White House asked me to join a committee of about 32 state lawmakers from around the country to help advise them on health reform, learn more about it, share that information with our constituents and the citizens of our Commonwealth. And it's been a fascinating experience and a great opportunity to meet colleagues from across the country, but most importantly, to advocate for the needs of Pennsylvania in that room. And so we've tried to do that. Look, something I think will pass in Washington. At the end of the day, though, once it passes, it's really going to be up to the states to go out and implement that and make sure that it's implemented in a way that helps, reduce cost and increase access for our people, while at the same time not undermining the very, very good programs that we have in Pennsylvania. For example, PACE and PACENet, which take care of so many of our seniors' prescription drugs needs. We don't want to undermine that. We only want to enhance it. So I'm authoring legislation called the Healthcare Reform Implementation Act, which creates a commission here at the state level to work with our federal brothers and sisters to enact the reforms in a way that benefit the people of Pennsylvania once those bills are passed in Congress and signed by the President. It's going to be a necessary component to ensuring that the reform actually works for the people of our Commonwealth.
Well, certainly it's an issue people are concerned about. If anyone has any ideas or questions, they can always go to your website, pahouse.com/Shapiro, to provide some feedback.
Absolutely. They can do that, and they can follow minute-by-minute updates on Twitter, following me at Josh_Shapiro, and they can share their thoughts on my website, in an email, on Twitter, on Facebook. You can fan us on Facebook. There's plenty of ways to be in touch with me, and I always appreciate the feedback from my constituents and my friends and people across Pennsylvania.
Well, thank you for joining us and updating us on the status of healthcare and your work here in Pennsylvania. We're going to leave you with a look at some of the contact information for Representative Shapiro.